I see a really wide breadth of patients in my practice. It's one of the reasons I really love my job. I can start the morning with a 13 or 14-year-old who's dealing with the challenges of having an irregular period and may be very self-conscious about some hair growth or acne. The middle of my day may be a couple who comes to see me as they're struggling with infertility, and the end of the day may bring a patient who's gone through an early menopause and wants to talk about how to manage those symptoms. So I think one of the most exciting parts of my job is that I don't really have a typical day. Every day brings something new, and I feel like I'm constantly learning from my patients. I think with any patient, I realize it takes a lot of courage to come in to talk about your problems. So whether I'm seeing an adolescent or a couple who's struggling with infertility, I really do try to remember that. What I often say to my patients is it's important to have a plan. I mean, there's so much in our lives that we cannot control. And I think that oftentimes once people can sit down and feel like they have a plan and we know how to address it and we know at least step 1 through 3, that gives people a lot of comfort and reassurance, and that's sometimes all it takes. I'm inspired every day by what I see, the bravery, the determination. I have a patient who just recently went on this journey, and at the end of the day, she turned to me and she just said, "What you do matters." And I think that says it all to me. I've had many, many conversations that are very difficult and, may start in tears, and then our journey culminates with absolute joy. And there may be tears at the end of that journey, but they're tears of joy because, they're pregnant. I'm Dr. Suleena Kansal Kalra, Assistant Professor of Obstetrics and Gynecology at Penn Medicine.